Warm greetings from the High 10. It is Everyday Shenanigans on this Wednesday, April 1st, 2020. I'd like to bring you said information pertaining to the coronavirus, and this said information is brought to you by NPR. Who's sickest from COVID-19? These conditions tied to increased risk. And this was dated this morning. Yesterday morning. A new analysis from the Centers for Disease Control and Prevention finds that people with chronic conditions, including diabetes, lung disease, and heart disease, appear to be at higher risk of severe illness from COVID-19. The report finds 78% of COVID-19 patients in the U.S. requiring admission to the intensive care unit had at least one underlying condition, and 94% of hospitalized patients who died had an underlying condition. The analysis is a preliminary snapshot based on data from about 7,000 cases in the U.S. and about 200 deaths. These results are consistent with findings from China and Italy, the CDC researchers conclude in a report published in the MMWR, the Morbidity and Mortality Weekly Report, on Tuesday. These findings highlight the importance of COVID-19 prevention in persons with underlying conditions, the paper concludes. Among COVID-19 patients admitted to the ICU, 32% had diabetes, 29% had heart disease, and 21% had chronic lung disease, which includes asthma, COPD, and emphysema. In addition, 37% had other chronic conditions, including hypertension or a history of cancer. The report includes a snapshot of cases among children and teenagers, and it adds to the evidence that people of all ages are vulnerable to infection. Lord, this article won't let me get to where I'm trying to go. The analysis concludes that about 23% of the COVID-19 cases were among children and teens under age 19, but only a small number of these young patients were known to be hospitalized. The CDC documented 48 hospitalizations among this age group. 8 young patients were sick enough to be admitted to the ICU. The report does not distinguish within the 0 to 19 age group. Keep in mind this snapshot is preliminary. The analysis was limited by small numbers and missing data because of the burden placed on reporting health departments with rapidly rising case counts, the researchers write, and the picture could change as more data becomes available. Overall, this report bolsters the evidence that people with chronic disease may be hit hardest by COVID-19 in terms of severity of symptoms and complications, but it's important to note that about 60% of cases evaluated in this analysis were among people who did not have documented chronic conditions. Healthy, younger people can be vulnerable too. As we've reported, a prior analysis, also based on preliminary data, found that nearly 40% of the people hospitalized in the U.S. were 55 years old and younger, and 20% were people ages 20 to 44. And this is brought to you by NPR, if you need verification. So let me recap that said information. From the preliminary data, 40% hospitalized in the U.S. were 55 years old and younger, which that's almost half, and 20% were people ages 20 to 44. And so, as they state, 23% were among children and teens under age 19, but only a small number of those patients were known to be hospitalized. And the CDC has documentation of 48 hospitalizations among this age group. 8 young patients were sick enough to be admitted to the ICU. Okay, we'll go back up. So diabetes at 32%, 29% had heart disease, and 21% had chronic lung disease, which includes asthma, COPD, and emphysema. In addition, which was the highest percent, 37% had other chronic conditions, including hypertension or a history of cancer. So you see, a lot of people here in America, and I guess also abroad, do have hypertension and cancer, um, lung disease, asthma, diabetes. So far, that's the risk. So hypertension is standing at 37%, which is the highest. And a lot of people do have high blood pressure. So that's over diabetes, which was at diabetes rated at 32%, hypertension at 37%, and cancer. And many people have had these issues. Cancer may be in remission, so they're at risk, I guess, if they've had cancer, currently have cancer. You have high blood pressure, heart problems, asthma, and God knows what else people have wrong with them. I still am in limbo as far as the young people who were diagnosed with this coronavirus in Davidson County, which is Nashville, Tennessee. They had a high rate of young people being diagnosed with this COVID-19. And what I found interesting about that is that this age group was 21 to 30 years of age. So what I had to ask myself, you want me to believe that all those people that were diagnosed between that age group a week or so ago also had heart problems, diabetes? You understand what I'm saying? I'm just leery on that notion that a lot of the people who are being diagnosed in America have all these health issues or have a health issue. Because when I think of young people, I don't think of them having major health problems. I'm not saying that they don't have them. I'm not saying they can't have them. I'm just thinking just generalization. Usually young people don't have a lot of health problems. They don't acquire health problems until they get a little bit older. But if we don't get any statistics to say, hey, yes, these group of kids who were diagnosed, young people diagnosed between 21 and 30, didn't have an underlying condition. Do you understand what I'm saying? I would prefer that you tell us that they had something. One or two or three or however many actually has a health issue. That way we can get a broader sense of what is going on with this virus, because at the moment we don't know this virus from Adam, okay? And we don't know if it's also plaguing healthy people, but as you see in this article, it states that no one is exempt from getting the virus, because that was stated, as it states right here, and it adds to the evidence that people of all ages are vulnerable to the infection. Because remember, when it first started out, it was released to the public that people 60 and older were getting the virus. Now we see people under 60 getting the virus. And younger children getting the virus. So that's why I said, when I start hearing of a 10-month-old dying, a 6-year-old dying, an 11-year-old dying, you want me to believe, whomever, that a 10-month-old had an underlying condition, the 6-year-old had an underlying condition. I'm just saying, because if no one reveals that to us, we will start to wonder what is really going on with this virus. Is it just plaguing elderly, middle-aged? But we know that can't be true, because now we're seeing people of all ages, demographics dying from COVID-19. But I think most of us are leery of the underlying conditions, or some of these younger people who have passed away. Did they or did they not have an underlying condition? That's my only thing. I'm praying for all. I'm praying that you all stay inside, because as you see, most places are not adhering. People are still having church. People are still going out, hanging out, shopping, doing whatever, children playing outside. And they're telling you, the medical officials are telling you, the more you hang with people, linger amongst people, you have the chance and the propensity to get this virus. So basically, it is on you. And yes, I know that we could easily get it just taking that one trip to the grocery store to get some said goods. So I always say it's like the roll of the dice. You're damned if you do, you're damned if you don't. But I just wanted to bring you all those statistics. It's up in the air because it's preliminary data, because naturally they're not getting data from everywhere. They stated that in this article because so many people are getting sick, and I guess it's a matter of reporting and getting it all out there to the CDC and said officials who can give account of who's got sick, who's actually diagnosed, if they had an underlying condition or not. But we will pray for everyone. I'm praying for myself. I'm praying for you all. I'm praying for everyone that is walking, that they do not get this virus. I am praying it dies down. I am praying that there is a vaccination, because we don't need a virus to just die down. We need a cure just in case time goes by, we don't hear of anyone else getting sick or dying, and then it pops back up 2 or 3 months after, we don't hear of any said demises pertaining to this virus. I'm praying for no mutations of this virus. They're already saying that there are other strains of the virus. I'll bring you that said information when I can, but to me, that's just as worse. And I've come to understand that about viruses, they do have different strains, that even with HIV, it has different strains. Isn't that interesting? Everybody doesn't have the same strain of HIV. And I was listening to a Facebook post, some girl talking crazy about HIV and da-da-da-da, and I thought, you know what, honey, I don't want to hear anything about HIV. HIV, what does that have to do with this? We all know that HIV is contracted through sexual acts, semen, and blood. So I don't know why anyone would even bring that subject up in relations to this virus, and I don't see that they are the same. I don't see that they are the same at all, because we already know how you can get HIV/AIDS, and it's not from coughing and hacking on somebody or being around them or in the air. HIV don't work like that. So to even put it in the same category with this, and that, oh, most people would have AIDS and HIV if it was airborne and this and that. However, she was wording it, I didn't want to hear it because it was stupid. And I don't see the correlation with HIV and this virus. Some people are trying to twist this into other things, and I'll bring that in another video. But my thing is, stick with what you know and stick with what is common sense. You can believe what you want to believe, but know that people are dying, and this ain't nothing to play with. Corona is here. She is here for now, and that's the spoken word. Prayers to all of you. Thanks for listening. Like, share, subscribe. Thanks for joining me on this cool Wednesday in the high 10, and I thank you all for participating and listening to me. And I pray that you all are staying safe, and you're washing your hands, and you're keeping your hygiene up, and you are staying out of harm's way and staying to yourself and zoning out, because right now we all need to be doing that, because we will drive ourselves crazy dwelling on this disease and watching the newscasts and the social media posts and the fake posts and fake statistics that people are running amok with, and other scams. Just stay in the know and stay leery and stay vigilant and keep yourself safe. Praying for all of you. God bless America. God bless those abroad. And until the next video, this is Everyday Shenanigans. Thanks for joining me. Bye-bye.